It could be serious. We're not too sure yet to the extent. Okay, if I can keep you updated, I will.
There's been one explosion on, near or under a train at Liverpool Street on the Met.
When I got to the Turnpike Lane tube station, it was a really busy day. You couldn't even read a book that day. It was so busy. It was so crammed into the carriage. And we'd only been in the tunnel a few seconds and the explosion happened.
So no one is completely sure what has happened, but as far as I'm concerned, a bomb has gone off.
I just knew it was an explosion. You couldn't hear it, but you could feel it. It was like a real pressure around you. If everyone tries to explain what a bomb is like, you can feel the force, if you like, of that explosion around you.
Yeah, train 204 is on the track between us and Liverpool Street. They are detailing themselves, I've been advised.
When I came to and I settled down, I started hearing the screaming of people around, and then when the people that could walk off the carriage, they got off the carriage, then that's when it became more silent, and that's when it was eerie, and that's when it was, you could just hear the individual screaming of the people that were left, the 20 or 30 people that were left in the carriage at that time. I tried to get up and I couldn't get up, and I had all the tube sort of rails lying on my legs or things lying on my legs, and I couldn't lift them up. And it was at that point that I realised that I'd lose my leg at that point. It's a natural instinct, I think. It's always been there. I guess I have to put that down to my parents, I would say, that have installed that kind of get on and get up and move on attitude, and also the working in healthcare and knowing that this wasn't the end of the world. I've been in healthcare's my thing. I worked in the operating theatres for, about 15 years. For me to have been through that in my whole career, and then to be injured so badly, and knowing that if I'd have been in another country with the injuries I had at that time, I probably wouldn't have survived. I met a gentleman over there who'd lost his leg, and the differences between what I'd had access to and what he would never have access to, and it was really important actually for me to be able to see that and realise that. And what was even more important for me was if I didn't know how lucky I was then I should have then. The Oxfam staff that we met in Georgia were incredible, and the Oxfam staff there were wanting us to promote the rights, wanting us to take that message away and spread that message that we have a basic human right to have access to healthcare, and we need to continue that message and push that message through, and that's why people support Oxfam, and that's why we need to continue, because without people who support the charities and without the great work that they do in fundraising and spreading that message, then we wouldn't be able to do the amazing things that are being done in countries like Georgia.
That video, it's shocking, but I'm very proud of what Oxfam are doing.
I feel proud to help the people in Africa.